Hello, and thanks for joining me on this edition of the program, Conversations with Alice. I am Aliceagada. Today on the program, our conversation will be centered on addiction. Addiction is a complex and multifaceted condition, characterized by the compulsive and uncontrollable use of substances or engagement in behaviors, despite negative consequences. It is considered a chronic brain disorder that affects the reward, motivation, and memory functions of the brain. There are primarily two types of addiction: substance addiction and behavioral addiction. Substance addiction involves the repeated use and dependence on substances like alcohol, nicotine, opioids, cocaine, or prescription drugs. Behavioral addiction, on the other hand, encompasses compulsive behaviors such as gambling, internet gaming, shopping, or even exercise. Addiction begins with the initial exposure to a substance or behavior, which may provide pleasurable or rewarding experiences. The initial positive reinforcement leads to the desire to repeat the experience, eventually leading to a pattern of repeated use or behavior. Over time, the brain undergoes changes in its reward system, making it increasingly difficult to resist the urge to use or engage in the addictive substance or behavior. The neurobiological basis of addiction involves the brain's reward pathway, primarily centered in the mesolimbic system. This system releases dopamine, a neurotransmitter that plays a role in pleasure, reward, and motivation. When exposed to addictive substances or behaviors, this pathway is hijacked, leading to the release of excessive amounts of dopamine. The abnormal surge in dopamine creates a euphoric feeling, reinforcing the behavior and making the individual crave for more. As addiction progresses, the brain becomes tolerant to the substance or behavior, requiring higher amounts or more frequent engagement to achieve the same desired effect. This leads to the development of dependence, where the body adapts to the presence of substance and experiences withdrawal symptoms when the substance is removed. Withdrawal symptoms can range from mild discomfort to severe physical and psychological distress, which can perpetuate the addictive behavior as the individual seeks to avoid or alleviate these symptoms. It's important to note that addiction is a complex condition, and the manifestation and characteristics of these addictions can vary from person to person. Additionally, individuals can experience multiple addictions simultaneously or develop new addictions over time. There are different types of addiction, each characterized by a specific substance or behavior. Here are some of the most common types. 1. Substance addiction. This includes addiction to drugs or alcohol. People with substance addiction struggle with compulsive drug or alcohol use, leading to negative consequences in their personal, professional, and social lives. 2. Nicotine addiction. Nicotine addiction is commonly associated with tobacco products like cigarettes, cigars, or smokeless tobacco. It creates dependence and cravings, making it challenging to quit. 3. Prescription drug addiction. Some individuals become addicted to prescription medications and use them in ways not prescribed or for non-medical purposes. 4. Gambling addiction. Also known as gambling disorder. This addiction involves uncontrollable and compulsive gambling, despite negative consequences. People with this addiction may experience financial problems and difficulty controlling their behavior. 5. Internet and gaming addiction. With the rise of technology, some individuals develop addictions to the internet or video games. This addiction involves excessive and compulsive use, leading to impaired functioning in various areas of life. 6. Food addiction. Food addiction is characterized by a compulsive and uncontrollable consumption of certain types of food, similar to addictive behaviors associated with substance abuse. It can lead to obesity, health problems, and emotional distress. 7. Sex and pornography addiction. This addiction involves compulsive and excessive sexual behavior or an overwhelming urge to consume pornography. Individuals may face difficulties in relationships, work, and maintaining a healthy sexual life. There are several situations and experiences that can contribute to the development of an addiction. Here are some common factors. 1. Genetic predisposition. Certain individuals may have a genetic predisposition that makes them more susceptible to developing an addiction. Genetic factors can influence how the brain responds to substances and how vulnerable a person is to developing dependence. Some individuals have a heightened ability to addiction due to genetic factors. Certain genes can influence how the brain responds to substances and increases the risk of addiction. 2. Mental health issues. Those with mental health disorders such as depression, anxiety, or trauma-related conditions may be more prone to addiction. Substance use might start as a form of self-medication to alleviate their symptoms, but it can quickly escalate into addiction. Substance use can temporarily alleviate symptoms, leading to a cycle of addiction. 3. Childhood trauma or adverse experiences. Any life trauma or adverse experiences such as abuse, neglect, or unstable family environments have been linked to an increased risk of addiction. These experiences can affect development and contribute to coping strategies that involve substance use. Experiencing traumatic events or abuse, whether physical, emotional, or sexual, can increase the risk of developing an addiction. Substance use may become a coping mechanism for dealing with the pain, anxiety, or emotional distress stemming from these experiences. 4. Coping mechanisms. Addiction can also develop as a way to cope with difficult emotions or situations. People may turn to substances or behaviors as a way to escape stress, trauma, or other challenging experiences. The temporary relief they experience can lead to a cycle of dependence and addiction. Inadequate coping mechanisms or poor stress management skills can contribute to the development of addiction. When facing challenging situations, individuals may turn to substances as a way to escape or numb their emotions, thus creating a dependence. 5. Environmental factors. Social and environmental factors, such as poverty, lack of access to resources, or living in a community with high substance abuse rates, can contribute to the development of addiction. These factors can create stress and increase the likelihood of turning to substances as a means of escape or coping. The environment in which a person grows up can play a significant role. Living in a home with substance abuse, having friends or persons who use drugs or alcohol, or being exposed to a culture that normalizes substance use can increase the likelihood of developing an addiction. 6. Peer pressure. Pressure from friends, colleagues, or social circles to engage in substance use can be a strong influence. The desire to fit in or be accepted by a particular group can drive individuals to experiment with drugs or alcohol, which eventually escalates into addiction. 7. Pleasure-seeking mechanism. Many addictive substances or behaviors trigger the brain's reward system, releasing chemicals like dopamine that creates pleasurable feelings. The reinforcement can make it easy for individuals to become addicted as they seek the repeated pleasure associated with the substance or behavior. It is important to note that while these factors can increase the risk of addiction, they do not guarantee that an individual will develop an addiction. Each person's journey is unique and different. and different combinations of these factors can contribute to the development of addiction. Addiction can have profound, wide-ranging impacts on individuals, relationships, and society as a whole. Here are some ways in which addiction can negatively affect people. 1. Physical health. Substance addiction can lead to various health problems such as liver damage, respiratory issues, cardiovascular complications, and increased risk of infectious diseases through shared needles or risky behavior. 2. Mental health. Addiction often co-occurs with mental health disorders such as anxiety, depression, and personality disorders, worsening their symptoms and making the recovery process more challenging. 3. Financial problems. Maintaining an addiction can be costly, as individuals may spend substantial amounts of money to sustain their substance use. This can lead to financial instability, job loss, debt, and even homelessness. 4. Relationship strain. Addiction can strain relationships with family, friends, and romantic partners. Trust may be broken, communication may deteriorate, and loved ones may experience emotional and psychological stress as they try to support the individual with the addiction. 5. Legal consequences. Substance abuse can lead to various legal problems, including arrest, fines, incarceration, engaging in illegal activities to obtain drugs, or engaging in risky behavior while under the influence. The perpetuation of addiction poses additional dangers, including 1. Tolerance and dependence. Continued substance use often leads to tolerance, where higher doses are required to achieve the desired effect. This can eventually develop into physical and psychological dependence, where the individual experiences withdrawal symptoms and intense cravings when attempting to quit. 2. Escalation of substance use. Over time, individuals with addiction may need to increase their substance use to experience the same level of pleasure or relief. This can lead to a vicious circle of increased consumption and further negative consequences. 3. Risk of overdose. As tolerance increases, individuals may engage in risky behavior, such as taking higher doses or using multiple substances simultaneously, increasing the risk of an overdose. Overdoses can be life-threatening and may result in permanent damage or death. 4. Social isolation. Addiction can lead to isolation and withdrawal from social activities and support systems. This isolation further perpetuates the addiction, as individuals are more likely to rely solely on substance use as a coping mechanism. Overall, addiction can have severe and lasting impacts on individuals' physical and mental well-being, relationship and societal functioning. It is crucial to seek help and support to break the circle of addiction and begin the process of recovery. Overcoming an addiction is a challenging process, but with the right strategies and support, it can be achieved. Here are some methods and ways to overcome an addiction. 1. Acknowledge the problem. The first step in overcoming an addiction is to admit that there is a problem and accept the need for change. This recognition creates a foundation for further recovery efforts. 2. Seek professional help. Consulting with a healthcare professional, such as a doctor or addiction specialist, is crucial. They can provide a comprehensive assessment, recommend appropriate treatment options, and offer guidance throughout the recovery process. 3. Engage in therapy or counseling. Various forms of therapy, such as cognitive behavioral therapy, motivational interviewing, or group therapy, can be effective in addressing underlying issues and developing coping skills. Therapists provide a safe space to explore emotions, learn healthier behaviors, and set achievable goals. 4. Consider medication-assisted treatment. For certain addictions, medication may be prescribed to help reduce cravings, manage withdrawal symptoms, and support recovery. However, this method should be done under medical supervision. 5. Build a support network. Surrounding oneself with a supportive network of friends, family, or support groups can be instrumental in recovery. Organizations like Alcoholics Anonymous or Narcotics Anonymous provide a platform to connect with others who share similar struggles and offer guidance and accountability. 6. Make lifestyle changes. Developing a healthy routine can aid in recovery. Focus on activities that promote physical and mental well-being, such as regular exercise, balanced nutrition, sufficient sleep, and stress management techniques. Eliminating triggers and temptations from the environment, such as removing alcohol or drugs from the home, can also be beneficial. 7. Set realistic goals and celebrate progress. Overcoming addiction is a journey, and setting achievable goals along the way helps maintain motivation. Celebrate each milestone, no matter how small, as it signifies progress and builds confidence. 8. Practice self-care. Engaging in self-care activities like relaxation techniques, meditation, mindfulness, hobbies, or creative outlets is important. Developing healthy coping mechanisms can help manage stress and prevent relapse. 9. Stay committed and seek ongoing support. Recovery is an ongoing process, and it is essential to stay committed to long-term sobriety. Continuing therapy, attending support group meetings, and seeking mentorship or sponsorship from individuals who have overcome addiction can provide ongoing guidance and accountability. Support from family, friends, and society is crucial in helping someone struggling with addiction. Here are some ways they can discourage the addiction and contribute to their recovery. 1. Education and awareness. Family, friends, and society can educate themselves about the addiction, its causes, and treatment options. This will help them understand the challenges faced by the person struggling with it and offer appropriate support. 2. Non-judgmental approach. It is important to approach the individual with empathy and understanding, and without judgment. Shaming or blaming them can worsen their self-esteem and hinder their recovery. Show them that you care for them and that you support them. 3. Open communication. Encourage open and honest communication. Create a safe and non-threatening environment where the person feels comfortable discussing their struggles, fears, and concerns. Avoid confrontation, as it may push them away. 4. Set boundaries. While being supportive, it is vital to set clear boundaries. Be clear and assertive on what behaviors are acceptable and what the consequences might be if they are disregarded. This helps maintain a healthy environment for everyone involved and promotes accountability. 5. Encourage professional help. Encourage the person struggling with addiction to seek professional help from therapists, counselors, or rehabilitation centers. Offer assistance in finding appropriate resources and accompany them to appointments if needed. 6. Encouragement and positive reinforcement. Celebrate milestones and successes, no matter how small. Offer encouragement, praise their efforts, and let them know that they are making progress. This can boost their self-esteem and motivation. 7. Avoid enabling. Avoid enabling their addictive behaviors by not providing them with opportunities or resources that enable their addiction. This may involve refusing financial support for destructive habits or refusing to cover up their actions. 8. Support groups. Suggest attending support groups like Alcoholics Anonymous or Narcotic Anonymous. These groups provide a sense of community, shared experiences, and accountability. Offer to accompany them to meetings if they feel hesitant. 9. Create a sober environment. In the home and social circles, avoid situations that could be triggers for addiction. Refrain from using substances around the person struggling, and organize activities that do not involve substances. 10. Long-term support. Be prepared for setbacks and relapses. Recovery from addiction is a lifelong process, and consistent support is necessary. Be patient, understanding, and continue to support them on their journey to recovery. Remember, addressing addiction requires a multifaceted approach, and professional help should be sought when necessary. Each person's journey to recovery is unique, and the methods that work may vary. It is crucial to personalize the approach and seek professional guidance to address specific needs and challenges. Let's keep the conversations going. See you next time, and bye for now.